Hi, today I'm going to be doing Lanluma non-surgical buttock enhancement. This is an injectable treatment where we use a material that will stimulate collagen in the buttocks gradually over many weeks. It's safe and well tolerated generally, and the product is a powdered version of PLLA or polyl-lactic acid, and that's really like a dissolving suture material. So if you've ever had stitches done internally and then the skin is closed on top of that with a removable stitch, this is the kind of material that's used in the dissolving stitch. We mix it with some sterile salty water. We mix it with lots of sterile water, and we add in some numbing medication. And we hydrate that mixture, we shake it, we let it stand, we shake it again. So we want it to be a nice even mixture. And then we map out the areas we're going to treat in the buttocks. So often we get hip dips at the side, or we lose volume in the upper portions of the buttocks and they get a bit flat and a bit saggy. So you can use this to enhance that. What we do then is we use a really tiny little needle, which is barely visible, called a 34 gauge needle. And we use that to add in some numbing at the sites where I'm going to put in my cannula. We've done lots of cleaning, we've done lots of photos and consent beforehand. Then I'll use an 18 gauge sharp needle to make an entry point. I'll wiggle that around, and then this is the main tool I use, a 20 gauge 100mm cannula. So that's blunt. It goes very gently under the skin. It's nice and straight, and I use that to distribute the product really evenly over the areas I want it to go. We massage it a lot. We put in numbing to make it as comfortable as possible. There's no general anesthetic. It's all done under local. We keep it squeaky clean. We use adhesive bandages afterwards to help kind of keep the buttocks up. We don't put too much in the lower poles of the buttocks because we don't want them to get saggy or heavier. And then we wait for the collagen stimulation to happen. What we're doing is placing it underneath the skin to really thicken the skin, and we're not placing it in the muscle or underneath the muscle. It's very different to a BBL or a surgical buttock enhancement, where you're taking fairly substantial volumes of fat from another area and putting it into the buttocks. And we know that carries surgical and anesthetic risks. So this is considered certainly a safer procedure, much less invasive, no general anesthetic. The recovery time after Lanluma is very quick. You can exercise straight away, you can drive home, you can walk, you'd be a little bit tender, you could get some bruising. We don't treat active skin infections. Generally, we'd recommend people take the next day off work because you don't want to be sitting all day at a desk. But you can exercise. We do a really deep tissue massage when we're finished to get the product really evenly distributed. We can use different tools as well under the skin to help break up little cellulite bands, so it's got a dual benefit there. And then over several weeks, the collagen stimulation starts to work. Most people need a couple of sessions. We generally use one vial in each buttock, and this is the Lanluma X, which is the larger vial, and there's a smaller one, Lanluma V, which you can use in a smaller area of the body or can be used in the face. I went to the US in 2018 to train to do this procedure with PLLA, and I like it. I think it's safe. Once the expectations are clear on both sides that it's not going to give BBL results, then it's a really nice procedure, especially for people just losing a bit of volume. You know, they're often active, they're working in the gym to build the glutes, but this is really on top of the glutes, getting that skin thicker, softer, stronger, and really getting that nice volume enhancement and a nice lift. So you may need to do a couple of procedures, or what you can do down the line is you can add a smaller amount just to sort of keep it topped up. Generally, it should last 18 to 24 months. Some people will get longer, some people might get a little bit shorter, because we always say individual results vary depending on the age and the skin quality and the expectations and the volume loss that that person has. But we're really just trying to be, you know, clear and transparent and fair, that we show you what it can do and that we'll also show you what it cannot do. What's the downtime? You'd be a little bit sore afterwards, but you could take 2 paracetamol if you need to. You can exercise, as I say, straight away and drive home. You could get some bruising, and because we really hyperdilute this with a lot of liquid, we're allowing that to spread over a big area in the buttocks. And when we used these kind of products many years ago, the products could clog or cause little lumps or nodules, and now we've learned to really dilute it a lot more so that the risk of side effects should be really tiny with it. But you could get a little bit of a lump. We're careful not to inject into blood vessels. We just take our time. It's not a quick procedure. It's really artistic. You want to do your procedure with the patient lying down on their tummy. As I say, we clean, we wear sterile gloves, and then we stand the patient up afterwards and we refine any little areas that might need a tiny bit of extra volume.